past 100 years or so, there have been many of the top scientists and best doctors who have ever lived did not buy this whole idea that there are hundreds of diseases which must be protected against by pharmaceutical drugs. A lot of them believe that really there is only one disease, and that is toxemia, or blood poisoning. How does blood poisoning happen? It happens, first of all, by the drugs and vaccines that you allow into yours and your children's sacrosanct bloodstream. There is a book available in every library in the United States called the Physician's Desk Reference, PDR for short. I just happen to have a copy, somebody gave me this, of the 1949 PDR. 1949 PDR. Now this book is only about 400 pages long, has a few hundred diseases for which there are drug protocols mentioned. Curiously, it has things like mercurochrome. Remember that? Yeah. And 5 other mercury-based medicaments. Anyway, don't get me started. It's a small book. The Physician's Desk Reference, 1949. Exhibit B. This is a fairly recent 2013 PDR, available in, wow, did you hear me? Available in any library. Almost 3,000 pages, literally thousands of diseases. Thousands of diseases, each with its own drug protocol, each protocol with its own ICD-9 billing code. So, take this thing.
So convenient, huh?
Yeah, the short version of this is these diseases were created for one reason and one reason only. This is one of the largest industries in the history of mankind. Why belabor the obvious, right? Now, in the psychiatric industry, they also analogously have their own book of diseases, the Diagnostic and Statistical Manual. In 1940, the DSM had only 26 mental illnesses that it had diagnoses for, with appropriate drug protocols. It was virtually a pamphlet in 1940. The most modern edition, the newest edition of the DSM is called the DSM-5, also printed in 2013, now has over 600 diagnosed medical diseases, each one of which has its own drug protocol and ICD-9 billing code. Now, it's amazing that the criticism of this number of mental diseases is not coming from the wacky chiropractors, is not coming from the holistic practitioners like myself. No, it's coming primarily from the psychiatric profession themselves, who are horrified at the lack of clinical foundation behind so many of these, quote, mental diseases. But it's, again, it's an industry. Now, lest I be branded as an anti-medical hysteric, I will acknowledge that on many occasions, organized medicine has saved my life. And I will also acknowledge this. At one time in their history, they really did pull the rabbit out of the hat. Remember? Yep. In the 40s. What? When? Of course, Alexander Fleming and penicillin and the other antibiotics saved hundreds of people's lives who would have died from bacterial infections. Fleming predicted it was a double-edged sword from the very beginning. We have antibiotic resistance. We have overprescription of antibiotics. Here's an interesting statistic. How many Americans die every year from diseases they did not have when they entered the hospital, which they acquired in the hospital, which were completely unresponsive to all known antibiotics? Answer is a conservative estimate.